Welcome to FAQ, where your patient questions are answered by leading experts in medicine and wellness. And now, here's your host, Hailey Hough.
Hi, I'm Hailey Hough, and welcome to FAQ. Today our question comes from Amy, a patient in Denver, Colorado. Amy asks, I just found out that I require physical therapy for a sports injury. What options do I have if I prefer for the therapist to come to my home instead of needing to go to their office? To answer your question, Amy, we turn to our guest expert, Dr. Jolene Foster. Dr. Jolene Foster, Doctor of Physical Therapy and board-certified neurological specialist, is the owner of B Mobile Physical Therapy and Wellness, PLLC, in Erlanger, Kentucky. Jolene earned her undergraduate degree in healthcare administration from the Arcadia University School of Global Business and her doctorate in physical therapy from Arcadia's College of Health Sciences. As a doctor of physical therapy, she is trained in treating neurological conditions, general orthopedic and musculoskeletal injuries, deconditioning from extended hospital stays, improving balance, assessing for fall risk to prevent future injuries, chronic pain, and more. Dr. Foster's practice specializes in in-home therapy. Welcome, Dr. Foster.
Thank you for having me.
So what are the options for patients who want to see the physical therapy in their home, and why is this often a better option?
I think to answer this question, I first need to explain the differences in the types of home therapy that you can get and how they work. So the traditional way of getting therapy in the home has been through a home health care agency, typically after you've had a hospitalization or surgery, or you've been in inpatient rehabilitation and you're considered to be homebound. For patients receiving this service is typically under their Medicare Part A benefits, and you need to need skilled nursing along with the therapy to get this service. So what typically happens is that a skilled nurse will come in a few times a week along with whichever therapy you need, which could include physical therapy, occupational therapy, speech therapy, and sometimes they'll send a personal care attendant. And their whole focus is making sure that one, you're medically stable in the home since you just came from the hospital. And two, to make sure you are safe in your environment and you're able to do the things that you want to do safely, kind of like your basic needs. So for instance, if the occupational therapist comes in, they'll make sure you're able to get off the toilet or shower or get dressed. The physical therapist will make sure you're able to walk to the bathroom. You have the strength and endurance to go from the bedroom to the couch without falling. So that's home health, and you have to be homebound to get that, meaning you're not able to get out of the house because of your medical situation. Once you're discharged from home health, whether you're no longer homebound or you've met all the goals, the typical thing is that you transition to an outpatient physical therapy clinic where you go to the clinic and 2 to 3 times a week for a few weeks, you keep working on improving your strength and meeting your mobility goals. The newer, it's not new, but it's gaining more popularity, is what's called mobile physical therapy. Others call it in-home outpatient physical therapy. And it's where an outpatient physical therapist comes into the home to treat you. It's billed the same exact way as if you were going to go into the clinic to get treated by a therapist. I would say the challenging part for this is that this is not offered everywhere. You would have to be able to find a physical therapist that is offering the service in your area. Once you find a therapist that's offering this service, there are tons of benefits for it. So, some small benefits is it's saving time. You're not having to commute to the clinic. You're not having to wait in the waiting room. Say the clinic is running behind. Sometimes that can take a large chunk of your day. And these days, with everything going on with COVID, it can also help you avoid more contact with people if you're, say, immunosuppressed and you're concerned about getting sick from being in a clinic. The 3 benefits that I really like when I go into a patient's home is, one, I get to work with that patient in their home with their home setup. Typically in the clinic, you're trying to replicate what the patient's home setup is. So say you're having a hard time doing your stairs or getting up off your couch, we're trying to replicate what's the height of the couch, what's the surface like, how many stairs are there, what's the rail that you have. If you're in the home, you don't have to replicate it. It's exactly what they need to be able to do, and you can practice it as needed. In addition to that, a lot of the times patients like going to the clinic to work on the big equipment, but most patients don't have equipment in their homes. So it's more beneficial to teach a patient how to improve their strength and what exercises to do in their home with what they have available. This way, you know that once they're discharged from your services, they're more likely to continue doing their exercises because they can replicate it in the home environment. The other aspect to it is, I believe, the privacy that you get in in-home therapy is a lot better than in the clinic. If you think of a physical therapy clinic, it's usually one large room where there's multiple patients and multiple therapists at one time. So maybe, the privacy may not be there as much as you want it to be. And I don't know about you, but I'm a very modest person, and I like my privacy. So the thought of having a therapist come into my home and work on exercises in my home sounds very good to me. Finally, it's all one-on-one individualized care in the home. Once again, if you're going to a very busy clinic, sometimes you're sharing your therapist with another patient at the same time, and they're going back and forth between you and that therapist. So you may not feel like you're getting the attention you need while you're there, but if the therapist is coming in your home, it's you and that therapist all one-on-one for the entire time. So there's definitely benefits to having the therapist in the home, but like I said, the challenge would be finding someone in your area that offers this service, because that can be a little challenging.
Right. Well, that sounds awesome. I didn't know, any of that. So I was just curious, I know that you did mention, the one-on-one aspect, being at home is usually a lot more beneficial. And I mean, after all, the goal is recovery, usually with physical therapy. So do you really see a difference in, maybe when they're at home, they're way more comfortable. Maybe the experience is a lot more quality because it is just you two and they're comfortable in their home and they don't feel weird doing any weird stretches or any weird workout, or they, like you said, which is a really good point, you are showing them the resources that they have around the house rather than, these big machines that they're going to only have access to for the time being that they're in. So do you see improvement or faster recovery, I should say, with the at-home experience than you do with going to the clinic?
I would say I've seen some research that shows that the patient gets better in fewer visits when it's done in the home. With my experience and some experience of my fellow colleagues who do the same type of therapy, we can spend longer time with the patient one-on-one. So you're getting more per visit, which then does correlate to quicker recovery, as long as the patient continues to do their part. Regardless of what the setting is, if the patient doesn't do their part when the therapist isn't there, you're not going to improve as quickly as you would like. So that's still a very important aspect, that even though they're coming into the home, you need to be able to be doing your exercises when the therapist isn't there, and then you'll see the improvements that you're looking for.
Right, definitely. And so then another question was, so you did mention that it's actually nice because you get the actual scale of the things that they're trying to, like you said, the couch measurements or their specific staircase. You get the actual feel for what they are trying to accomplish rather than trying to simulate it in the clinic. However, I was just thinking, would this be a problem considering, this might not be the only staircase that they're going to be walking up and down, or this might not be the only couch. Would you think that there's like any sort of benefit to giving them a more universal training at the clinic so that they are able to walk up any staircase or sit on any couch? And so in their mind, it's not just trained to, oh, I don't know if I can walk up this staircase. I've only done physical therapy on my one at home, or, that chair is a little tall. I don't, whatever it is. have you ever seen any sort of effect on that?
So I would say that what we would do in the clinic, you can still replicate in the home as well. So if they have different surfaces in the home, a good therapist would have the patient practice getting up from the couch, practice getting up from the bed, practice getting up from the kitchen table, from the toilet. So you're getting different heights, different surfaces. The stairs, I would say in the clinic, you're still just focusing on what they need to be able to do in the home, or if they say they want to visit a family member and they have a certain type of stair, you would still just, say, okay, let's use just one rail today, or let's practice doing these stairs without the rail to make it a little bit more challenging. And for me, I bring the equipment to the patient's home that if I wanted to replicate something different, I can. So I have sets of little stairs that I can bring and practice different heights. So as long as you're prepared, you can still practice more real world, as you're saying, activities instead of just what's in the home.
Right. And so lastly, I was wondering, a lot of things have to do with the way that your brain processes it or your mindset. So for me, I've been through physical therapy, I've had injuries and whatnot, and going to the clinic, it was kind of like a subconscious thing in my mind, like, okay, this is time to work now. This is time to work your leg. And then when I leave, it's like, okay, break time. I get to go sit on the couch and relax. However, with the in-home physical therapy, it's kind of a different thing because they're bringing it to you. So it might not be that same subconscious effect in your mind. There is no break time because the break time spot is also the physical therapy spot. So maybe in their mind, it's a thing better trained where they might feel more prone to working out after the physical therapist leaves because they realize this is also my workout space. This can be my workout space as well. So do you think that has any sort of contribution to their speedy recovery? Because your mindset does have, a lot to do with your recovery in a lot of cases.
Yeah, the mindset is everything. I tell all of my patients that I am just showing you what to do and it's up to you to do it. So whether it's in the clinic or in your home, yeah, you might be in the mindset in the clinic, but they're expecting you to go home and do your exercises throughout the week. So regardless, that's going to be the place where you're doing your homework if you're expecting to recover in a timely fashion and with the best results. Part of that comes down to the therapist saying, hey, these are my expectations. I can tell if you are not doing your home exercises. So let's be on the same page and be a team. And as long as they do their part and I show them how to keep progressing everything, then they should once again see the results that they're looking for.
Awesome. Well, you know what? I think that was a very thorough answer. And thank you so much for meeting with me today to talk about this. I mean, it was very interesting. And I think there's a lot of things that people didn't know, a lot of options that we discussed that would definitely be helpful to a lot of people. So thank you so much.
Thank you for having me.
I'm Hailey Hough, and I look forward to seeing you on the next episode of FAQ.